When beginning to brainstorm on what topic to cover, I knew I wanted to do something that involved nursing in children. Then when searching, I came across the article, Childhood Obesity, a Global Nutritional Concern, and knew this was the topic that interested me the most and seemed like a good topic to speak on. This journal article came from the International Journal of Nursing Education 3.1 on pages 44 through 49 and was published in 2011. The authors were Shanthai Gladstone, Nirmela, and Margaret Emanuel. This article defines childhood obesity and identifies the major problems caused by childhood obesity that will affect the child later in life. I chose this article because I plan to major in nursing, and Mississippi is at the top of the list for the most obese states in the nation. So I believe that if we can figure out what is causing childhood obesity and learn prevention methods, we can change that. The main focus of this article are the dangers, factors, prevention methods, and nurse management dealing with childhood obesity. I will be speaking on the 4 factors, explaining the severity of each. The terms obesity and overweight are often used interchangeably, when in reality they both have 2 completely different meanings. Overweight is an increase in body weight compared to the height compared with the reference standard. Obesity deals with the excess body fat. According to Center for Disease Control, obesity is defined as a body mass index, or also known as BMI, of greater than the 95th percentile with a BMI greater than 30. Obesity is one of the major causes of chronic diseases in adults. Research has shown that 80% of children who are overweight between the ages of 10 and 15 were obese adults at the age of 25. Childhood obesity is a result of interaction between food, state of mind, family, and the environment. Factors such as increased calorie intake, inactivity, and family factors, which can be either obesity in one parent or obesity in both parents, pose a risk to children. Today, children are replacing nutrient food with energy-dense processed food like burgers, pizza, noodles, and drinks, also fruit drinks. And they're also storing fat in the forms of ice cream, butter, cheese, and other carbs. Physical inactivity of children has shown to be a major cause. Very seldom do we see children playing in the yard because they are watching TV and playing video games and also using computers. Environment also plays a major role in food patterns of children. Parents nowadays tend to buy foods that are low in cost, convenient, and preferred by the child rather than focusing on the nutritional value. Heredity also may influence fatness. Infants to overweight mothers have been found to be less active and gain more weight starting as early as 3 months. A developmental factor that has proven to affect the rate of obesity is lack of breastfeeding. Other factors that are known to affect the rate of obesity are medical illnesses such as injury to the hypothalamus, Cushing syndrome, and cerebral palsy. Psychological factors like stress, low self-esteem, boredom, nervous depression are also to be blamed for childhood obesity. Lastly, the consumption of drugs such as corticosteroids, estrogens, and anti-epileptics have been identified to promote obesity. Obesity not only affects children physically, but also mentally and socially. It also reduces the lifespan of a child. It can also lead to life-threatening conditions such as diabetes, high blood pressure, heart disease, sleep problems, cancer, and many other disorders. Many ask the question, exactly how can you treat childhood obesity? Well, childhood obesity can be treated in 2 ways. With pharmacological management, meaning with medicine, or without medicine. Medicines that are known to reduce the weight in children and prevent absorption of fat in the intestine while also decreasing appetite are orlistat and sibutramine. Many ask, what does the nurse exactly have in the role of childhood obesity? Well, the nurse has a major role to play in the prevention of childhood obesity, whether in the hospital or the community. The best way to do so is either by warning the parents or educating the children on the prevention of childhood obesity. In conclusion, because of the severity of the results of childhood obesity, such as diseases or even death, effective strategies should be implemented to prevent and decrease childhood obesity and to ensure better quality of life for children. I think that if we raise enough awareness and prevention about the condition of childhood obesity, we can improve Mississippi and move it down on the list of the most obese states in the nation.